Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Cross River State government says it's poised to give COVID-19 a stiffer fight with more testing and sensitization. Oyo State government engages youth corps members in the COVID-19 fight. And in the face of mounting COVID-19 cases, French President Emmanuel Macron vows to make life difficult for the unvaccinated. Thank you for joining us on the program. According to the Director General of the International Vaccine Institute, an organization devoted to research on vaccines for poor countries, Jerome Kim, 2022 will be the year of vaccination, either primarily for people who haven't been vaccinated or boosters for those who have. Even though 2021 was mainly a year of vaccine development, COVID pills were also developed by drug makers Pfizer and Merck, with 2 antiviral pills to treat COVID-19 for emergency use. The first oral antiviral drug to be cleared for emergency use in the U.S. was Pfizer's COVID oral treatment pill called Paxlovid, and the other oral treatment pill was Molnupiravir, which was Merck's antiviral pill approved for use in adults with mild to moderate COVID at risk of severe disease. Well, in the meantime, latest figures released by the NCDC shows Nigeria recorded 8 fatalities from the pandemic, with 428 cases reported across 13 states of the Federation and the Federal Capital Territory. Let's check out the latest.
420 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 13 states and the FCT, indicating a drop from the figures reported earlier. Rivers accounted for the highest number of cases with 188 infections. Ondo had 54, FCT 42, Imo 25, Nasarawa 24, while Oyo registered 23 cases. Edo registered 18 cases, Akwa Ibom 16, Ogun 14, Osun had 10. Other states, including Kano, Ekiti, Borno, and Plateau states, logged a single-digit infection. The total confirmed cases in Nigeria now stands at 244,548. The report also includes a backlog of confirmed cases from Imo, Akwa Ibom, Kano, and Borno states, as well as 0 cases from Bauchi and Sokoto states. 634 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 216,814. There were 8 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,053. Currently, there are over 24,000 active cases in Nigeria, while more than 3.8 million samples have been tested so far. With over 14,000 positive samples, Lagos State accounts for the highest number of cases on admission, followed by the FCT and Delta State. More than 10.8 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 4.5 million persons have been fully vaccinated. The total global confirmed cases have surpassed 295 million, while deaths are beyond 5.4 million.
The Cross River State government has explained that all hands are on deck to ensure that the spread of both the COVID-19 pandemic and Omicron variants is curbed. Speaking in Calabar, the Cross River State capital, the Commissioner for Health, Dr. Betta Adu, explains that the state will improve on its surveillance and sample collection to improve vaccines coverage across the state. The state government is also calling on residents to take their health status seriously by presenting themselves for testing and vaccination to contain the spread of any variant.
We must improve on surveillance, right? We must actively search for cases because most people do not have the symptoms. Most people will have the symptoms but will not want to come forward because they don't want to be stigmatized. So we must improve on surveillance, sample collections. We must be able to also get people who are infected, treated or properly isolated. And beyond that, we must be able to increase our vaccine coverage as a state. We are doing very well. We have consistently been amongst the first 6 states in Nigeria as it concerns vaccine performance. At some point, we were topping the nation. We must continue to push this. That way, we'll be able to overcome the Omicron or any other variant that might come out from this whole COVID pandemic. So far, Cross River State has been able to confirm at least 712 positive cases by PCR. And we have got a lot more on the rapid diagnostic test kits. That's for the testing, and we're calling on more people to come out to get tested. The more we test, the more the surveillance, the more the contact tracing, the better it is for us to break that transmission spread in the state.
And over to the southwest, the Oyo State government says it remains committed to fighting the spread of COVID-19 as it continues to leverage on existing institutions to support. In collaboration with the World Health Organization, the state government is collaborating with the National Youth Service Corps to encourage people to keep observing the COVID-19 safety guidelines.
An aggressive campaign against the spread of coronavirus has become necessary because of the recent spike in COVID-19 cases in Oyo State.
When transmitting or getting infected.
To this end, the state government and representatives of the World Health Organization, WHO, are enlisting help from Youth Corps members at the Ishenyi camp in the state, where some Corps members are sensitized on what must be done to curb the spread of COVID-19. It's a collaboration that is jointly put together by the Oyo government and the World Health Organization.
We are here as an organization to support the government of Oyo State and the Emergency Operations Center for COVID-19 response. And this is a novel and beautiful concept by the government of Oyo State, taking positive advantage of the well-structured NYSC system, such that these young, vibrant, strong Corps members are used as elements of positive change in their various local governments and communities.
Some of the Corps members who have now become vanguards of this cause say they are prepared to begin to impact the communities where they serve.
COVID-19 is a disease that has ravaged the world for the last 2 years, and a lot of people are still not aware of the menace of COVID-19 and how to curb it. And so it's an opportunity to tell the Corps members and help support them in going into different communities, holding stakeholder meetings, town hall meetings, and ensuring that people are aware.
I will go back to my local government to spread the news of COVID-19 and also to tell people about COVID-19, the preventive measures to take to curtail the spread.
With the administration of booster shots currently ongoing in the state, the Oyo State government says it will not waver in its responsibilities to enlighten residents on the need to adhere to safety precautions to stem the spread of the virus.
According to the CDC director in the U.S., it's just shocking the number of pregnant people who died specifically in August last year, 1 month after the Delta variant became the predominant variant in the U.S. then. And now that the Omicron is fast spreading, she says she's even more worried for the unvaccinated and pregnant. But what is the current status in Nigeria? Joining us in the studio here in Lagos is Dr. Gregory Ohihoy. He's an obstetrician, gynecologist, and a chief research fellow with the Nigerian Institute of Medical Research, NIMR. Thank you for joining us on the program.
My pleasure, Millicent.
All right. So, yes, the National Primary Healthcare Development Agency said pregnant women, lactating mothers can take the vaccine, the COVID-19 vaccine. Is that still taking place? Yes,
and then that's the recommendation worldwide. You know, the CDC in Atlanta, that's the US CDC, has very clear recommendations on the use of COVID-19 vaccine in pregnancy. You know, like the data you actually quoted noted that, you know, the mortality from COVID-19 for pregnant women was quite disturbing, particularly in the early stages of the pandemic. And with the vaccine now known to be safe, at least from the current available data, it makes sense that pregnant women should have this vaccine. They should be encouraged to have the vaccine, irrespective of the stage of the pregnancy, first trimester, second trimester, third trimester, puerperium when they are breastfeeding, it's safe for them to have this vaccine.
Well, the question now is, are pregnant women in Nigeria really taking the vaccine? Is there any data to show the number that have received?
I think the real problem is that the communication, the messaging is not correct. I think we have to target pregnant women and let them know that it's safe for them to take this vaccine. We should incorporate this into our antenatal care program in many of our public settings. It should be a part of the antenatal care program. We should come out with practical strategic programs to encourage the pregnant women to take the vaccine. Just like we encourage them to take their tetanus tozoid immunization during pregnancy, we should make it a part of the health talk we give to them. You see, the challenge I have is that if you don't come up with a strategic program to solve a problem, you won't get the answers that you desire. We can't wish it and hope that the pregnant women will just take the vaccine. But if we encourage them, we incorporate it into our current antenatal structure, particularly in public hospital settings. We develop jingles, deliberate public health effort to raise the awareness, we'll be able to raise, vaccination rate among pregnant women.
We'll come back to some of the beliefs and perhaps myths concerning vaccinating pregnant women. But pregnancy, is it one of the underlying medical conditions that makes COVID-19 more susceptible to attacking them?
Not necessarily. I mean, the evidence we have so far doesn't show that pregnant women are more susceptible to COVID-19, as per a special group that is more susceptible, no. And we know that generally with pregnancy, there's relative drop in the immunity level. And anything that can drop your immunity level will make COVID-19 more aggressive. Remember that you're also dealing with two situations. You are also increasing the risk of the unborn child of having COVID-19. And the evidence is not so clear whether there's transplacental transmission of COVID-19 to the baby. It's still out there in the jury. And some data says there's transplacental transmission, so data doesn't support it. But what we know, which is more important, is that the vaccines are safe and they are effective. And we should encourage the pregnant women to take the vaccine.
So how much of that do people really know? Because there are fears about essentially it being associated with preterm delivery, underweight in the newborn. I mean, is there any study that shows that these vaccines are actually safe? And also, at the back end is those who are, rendering these services, antenatal care, are they really sending the message? Or, because I know some health workers who actually don't believe in the vaccines to start with.
Exactly, Abi. I think the last point you made really describes the situation we have. People have to, the health workers themselves have to have that conviction before they can even convince the pregnant women. There's enough data. Like I was just reflecting before I came to the studio. COVID-19 is no longer new to us, relatively. This is the fourth year, Millicent, it's the fourth year. It's 2019, 2020,
December
2021, 2022. So it is the fourth year we are dealing with COVID-19. There's some things we now know. I mean, we could have feigned ignorance, in the beginning and say we don't know many things. We now know there's enough data available in literature, available for those who are interested to show that, the vaccine is safe in pregnancy and people should be encouraged to take it. Of course, there will be myths. We were not aware from the current data that it decreases the risk of preterm delivery. It's not associated with any known congenital complications. Congenital, I mean complications or birth defects that you have when people have their babies. There's no data to show that as of this moment. But we know that it can cause deleterious, negative effects on mother and baby. We know that. So let's work with what we know. We know that the vaccines are safe. We know that COVID-19 can run a very aggressive course among pregnant women in some cases. And we know that there's a vaccine that can reduce the risk of severe infection. Note that it's not as if the vaccine will prevent them from having COVID-19 infection, but we know that at least it will prevent the risk of having severe infection and mortality in these women.
My final question is, very briefly, the Omicron variant, does it bring any added risk to the mix?
No. I mean, for what we know from the Omicron variant so far, the data we have shows that it's not as aggressive as the Delta variant, which is good. But remember also that the Omicron variant spreads very rapidly. So what we may have gained from the lack of aggressiveness of the Omicron variant, we may also lose in the sheer number of people who will get infected. Because if you have so many people getting infected, you are going to have so many people needing admission. You're going to have so many people that will overwhelm the health system. You're going to distract health workers from focusing on other aspects of healthcare. So I really think that really Omicron is not so special in terms of severity, but special in terms of its ability to transmit to people at a very rapid rate.
We appreciate your time. Thank you, and your knowledge on this issue. Thank you so much, Dr. Gregory Ohihong is an obstetrician, gynecologist, and chief research fellow with NIMA. Thank you for joining us.
You're welcome. My pleasure.
Well, we have more stories around the world about the coronavirus pandemic. Please stay with us. Welcome back. French President Emmanuel Macron has warned that he intends to make life difficult for people in France who have not been vaccinated against COVID-19. He told the Le Parisien newspaper that he really wants to hassle them and will continue to do this till the end. His comments come as a bill on COVID passes was delayed by opposition MPs uniting against the government. A debate in Parliament on the bill, which would bar the unvaccinated from much of public life, was prevented from continuing after midnight. The legislation is expected to be approved in a vote this week, but it has angered vaccine opponents. Meanwhile, in a matter of weeks, the COVID Omicron variant that was first detected in November surged around the world. Now, there are early tentative signs that the Omicron wave has peaked or is plateauing in the places that were among the first to be hit hard by the strain. We'll go over to South Africa. Professor Jerry Mfalele is Vice President for Research at the South African Medical Research Council. He joins us now for more on what's happening there. Thank you for joining us on the program.
Thanks for having me. Just a small correction. I'm the Deputy Vice Chancellor for Research and Innovation at Northwest University.
Well noted. Thanks again.
Thank you.
Thank you. Tell us, has South Africa passed the peak of the fourth wave?
Well, in all likelihood, it looks like we are coming out of, the fourth wave. So there was no magic, really, because there was no strict lockdowns. I think it's very much about the dynamics of Omicron. As a variant, it looks like for us as in South Africa, the variant was very mild, if I can put it that way. I like to believe that a lot of people were exposed to the variant, even those who were not tested or those who did not show up in hospitals. But because it's mild, obviously there were a lot of asymptomatic infections. And, for those who were testing, we have seen the numbers, they have rise and immediately, dropped. So it was not like, the other waves that we have seen where we had a protracted wave. So this is actually the difference between the current wave and the previous one.
But if we're looking at the waves also, one begins to wonder, and this is, with what is unique to South Africa, in this case, the fourth wave peaking, the US and Europe appear to be struggling. They're rolling out booster shots as fast as they can, but we're seeing loads of cases there.
Yes, I think, if you look at COVID-19, although we have got 2 years of experience with the virus, it looks like a lot is still unknown. So I'm saying this because I really don't understand, maybe the difference between the countries in the north and maybe South Africa. Although one can say that perhaps something that is unique in the Northern Hemisphere are going through their winter season, and perhaps that could be another factor that we need to take into account. So all over the world, it looks like the Omicron variant. It is mild, and because it's highly transmissible, the sheer numbers of people who get infected, obviously, and who might need medical care becomes huge. And I think this is where the health facilities become inundated with hospital admissions. But we know at this stage that the hospital admissions do not necessarily mean that most of the patients are on oxygen, for example, or they are in ICU. These are just symptomatic patients, and they just need, most of them require just normal care.
Prof, in a recent statement, the State Department of Health South Africa said cases were declining in almost all the provinces except the Western Cape and Eastern Cape, which recorded increases, rather 14% and 18% respectively. Why uniquely to those areas?
It's been a trend with other waves as well. So we know that not all areas or provinces will come out of the wave, at the same time. So the different areas in the country, they come out of the wave at different time points. So the wave started in Gauteng province, which is like, the economic hub of the country. But we have since then to other areas. And as you rightly said, there are still other provinces that are experiencing high numbers of cases, particularly the Western Cape and also KwaZulu-Natal. These are mainly the coastal areas. So it looks like, the cases have moved towards, the coastal areas. And it could be that, for South Africa, this time of the year, they move from the inland to the coastal areas as part of the holiday season. So that could actually, be one reason why the numbers are still high in the coastal areas.
If I might ask, I mean, this is, the fourth wave South Africa is coming out of, and one would say with South Africa and other countries around the world, Omicron is driving the surge in infections. But what is happening with the Delta variant, do you think?
Yeah, very interesting because the Delta variant is completely replaced by the Omicron. The first report of Omicron in South Africa was, somewhere on the 22nd of November, and by the end of November, 75% of the sequences that were monitored by the sequencing network, they were Omicron sequences. And by mid-December, almost 100% of the sequences were Omicron. So it just shows that variant is highly transmissible in a setting like South Africa. And obviously we have seen now with other countries. And is most likely to replace Delta in many other countries. I have no doubt about that.
Deputy Director, Research Innovation, Professor Geoffrey Mfalele, many thanks for joining us today.
Welcome.
The Omicron variant is driving record daily cases of coronavirus from the US to Australia, adding pressure on health systems. Now, daily coronavirus infections in the Netherlands have soared to a record high. Officials confirm that Omicron has become dominant in the country, while Israel's health ministry has also announced nearly 12,000 new coronavirus cases, the largest daily rise in infections since the beginning of the pandemic nearly 2 years ago. Here's more of the global update.
Israel has changed its COVID-19 quarantine and testing policy in what the health ministry described as an effort to ensure continued protection for vulnerable populations from a surge in infections fueled by the Omicron variant. PCR tests will be earmarked for people aged 60 and over with weak immune systems, while those at lower risk will be checked with rapid antigen tests. The country has confirmed around 1.4 million infections since the start of the pandemic and more than 8,000 deaths. About 60% of its 9.4 million population are fully vaccinated. The United States has reported nearly 1 million new coronavirus infections, the highest daily tally on any country in the world, and nearly double the previous U.S. peak set a week ago. The number of hospitalized COVID-19 patients has risen nearly 50% in the past week and now exceeds 100,000, marking the first time that threshold has been breached in a year. Australia's daily COVID-19 cases has hit a record high for the third consecutive day, further straining hospital resources and testing facilities as public anger grew over the handling of a fast-moving Omicron outbreak. New COVID-19 cases in India surged to 58,097 over the past 24 hours, a doubling of the daily tally over the past 4 days. Health experts have called for preparations to ensure hospitals are not overwhelmed by a new wave of patients. Hong Kong leader Carrie Lam has announced that the government will introduce a series of new measures to curb the spread of COVID-19. The new rules include a ban on flights from 8 countries for 2 weeks from January 8th, affecting Britain, the United States, Canada, Australia, Pakistan, Philippines, France and India. Singapore's COVID-19 task force says it expects the Omicron coronavirus variant to cause a bigger wave of infections than Delta and urges the country to prepare.
Yesterday alone, we reported 438 Omicron cases. Hence, it is very likely that we will see an Omicron wave quite soon. With local and international evidence indicating that Omicron is more infectious compared to Delta, we must be mentally prepared that the Omicron wave may be greater than the Delta wave we had experienced before.
Over in Europe, British opposition Labour leader Keir Starmer has tested positive for COVID-19. He had been due to face Prime Minister Boris Johnson at a question and answer session in Parliament later today. Starmer previously tested positive for COVID-19 in October. Poland's President Andrzej Duda has tested positive for COVID-19. He had previously tested positive for COVID-19 in October 2020. The president's aide says he's been vaccinated 3 times against COVID-19 and is in isolation with no serious symptoms.
We have more updates on our website, channelstv.com. You can find also a better understanding of the pandemic, plus other stories, breaking news. It's all at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.